why some filler patients are never satisfied, and what to do. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. What if I told you that the biggest complication in aesthetic medicine is not vascular occlusion, but the wrong patient? Because no matter how perfect your technique is, some patients will never be happy, and treating them can damage your outcomes, your reputation, and your career. In aesthetic medicine, most practitioners focus heavily on technique, anatomy, product choice, injection planes, complication management. And all of that is important. But there is one factor that determines your outcome before you even pick up a needle, and that is patient selection. Because not every patient should be treated. Now this is where many injectors get into trouble. They see a patient with a concern, they believe they can improve it, and they proceed with treatment. Technically, the treatment may be correct. But the outcome is failure, not because of the result, but because of the patient's perception. These are the patients who are never satisfied. They come back repeatedly. They focus on small imperfections. They request more treatment, even when the result is already optimal. And over time, this becomes a cycle: more filler, more adjustments, more dissatisfaction. So the question is, why does this happen? There are a few key reasons. The first is unrealistic expectations. Some patients are not looking for improvement, they are chasing perfection. They may bring edited photos, filtered images, or reference celebrities. They may use strong language like, "This looks terrible," or, "Everyone notices this," even when the issue is minimal or not visible at all. In these cases, the problem is not the anatomy, it's the expectation. And no amount of filler can fix that. The second is subtle psychological factors. Now not every patient has a diagnosed condition, but some may have traits of body dysmorphic disorder. These patients are preoccupied with perceived flaws that are either minimal or non-existent. And the key point is this: their concern feels completely real to them. Which means even if you improve the area, their perception does not change. They will continue to see the flaw. And often, they will shift their focus to another area. The third is poor assessment by the practitioner. Sometimes the issue is not the patient, it's the injector. If you don't fully assess facial proportions, skin quality, movement, and aging patterns, you may treat the wrong area. For example, a patient may complain about tear troughs, but the real issue is midface volume loss. If you treat the trough directly without addressing the underlying structure, the result will be suboptimal. And this can lead to dissatisfaction, even though the treatment was technically correct. The fourth is overtreatment. This often happens when injectors try to fix dissatisfaction with more product. Instead of stepping back, they continue to add filler. And this is where complications begin: migration, swelling, heaviness, distortion. The face starts to look unnatural. And ironically, the more you treat, the worse the outcome becomes. So what should you do in these situations? The first and most important step is recognizing the red flags. If a patient is overly focused on minor details, uses extreme language, or has a history of multiple treatments with ongoing dissatisfaction, you need to pause. This is not a technical problem. This is a patient selection problem. The second step is managing expectations. You need to clearly explain what can and cannot be achieved. Use simple language. Be honest. And if necessary, show them what normal variation looks like. Because sometimes, reassurance is more important than treatment. The third step, and this is the hardest, is knowing when to say no. Not every patient should be treated. And saying no is not a failure. In fact, it is one of the most important skills in aesthetic medicine. Because the safest injector is not the one who can treat everything, but the one who knows exactly when not to treat. And finally, you need to understand that your long-term success is not built on how many treatments you perform. It is built on your judgment, your ability to assess, your ability to select the right patients, and your ability to walk away from the wrong ones. Because in aesthetic medicine, the wrong patient will always lead to the wrong outcome, no matter how good your technique is. Thanks so much for watching. Don't forget to like, comment, and subscribe, and share this with someone who'd find it useful.